Hi, welcome once again. In this recording, we will explore the use of guidance practices that match children's personalities and development. We have learned before that children need guidance in order to feel secure and confident, and learn desirable ways of behaving. Children should eventually become adults who are valued by the society in which they live. We also need to bear in mind that guidance is different from manipulation. Manipulation is simply getting children to do what you want them to do. On the other hand, guidance requires that you think carefully and be honest with yourself, especially about why you expect children to behave in particular ways and why you react to their behaviors in the way that you do. Children should always be treated with respect and dignity. A positive approach to guidance does not include humiliation, ridicule, nor pressure to compete. Neither is it punitive, impatient, mean, or bossy. You should also bear in mind the suitability of the guidance practices you choose to employ in relation to children's personality and developmental levels. For instance, children with learning disabilities will require special considerations and attentions. Children with learning disabilities tend to be uneven in their development. For example, a child may have good motor skills but have a considerable delay in language development. In school-age children, these inconsistencies often lead to their being accused of not trying hard enough or being lazy, uncontrollable, and even stubborn. You should find the following approaches and practices effective in your working with children with learning disabilities. Here are a few. Focus on strengths and provide children with descriptive praise when they are successful. Give directions one at a time and allow adequate time for children to comply. Verify children's understanding of a request with appropriate questions. Teach new concepts or skills in short sessions with concrete materials that allow children to use several sensory modalities. Help children to focus on the task at hand by using attention-getting words such as look, listen, or watch me. We will now look at children with attention deficit hyperactive disorder, commonly known as ADHD. Children with disorder, known as ADHD, often show impulsive behavior beyond what seems developmentally appropriate. They also show an inability to stay on one task. They are easily excitable. They have trouble waiting on explanations or taking turns, and they rarely pause long enough to relax, watch, or listen. You need to be careful not to assume that every active child has an attention deficit disorder and avoid using it as a label for behavior. Children with ADHD will benefit from the following practices. Provide clear structures for the child with ADHD. Simplify the environment and reduce visual stimulation to assist the child to stay on a task. Make picture charts showing the sequence of daily routines. State your expectation for behaviors clearly. Be sure to acknowledge constructive and appropriate conduct because these children are likely to receive negative messages. And finally, where necessary, arrange for a professional evaluation to determine the best course of action when dealing with children with ADHD.